Welcome to the CiiTA Education Series, what every manufacturer needs to know about the 340B drug discount program.
Hello, I'm Jason Hardaway, Managing Partner of CiiTA LLC. Today we're going to discuss the very real issues surrounding duplicate discounts in the 340B program. Recent changes in the Medicaid drug discount program, including those enacted by the Affordable Care Act, have created uncertainty about responsibilities for ensuring prevention of duplicate discounts. This uncertainty leads to a significantly greater financial exposure on the part of the manufacturer, as no one has taken clear responsibility for prevention.
One of the primary mandates of the 340B program is that any prescription purchased at 340B discount price cannot also be subject to a Medicaid rebate. This stipulation was put in place to protect manufacturers from paying duplicate discounts on the same drug and potentially absorbing an actual loss on that drug's sale. Prior to the 2010 Affordable Care Act, the control mechanism designed to prevent duplication of 340B discounts and Medicaid rebates was relatively simple. Medicaid rebates only applied to fee-for-service programs. Participating covered entities were required to submit a Medicaid exclusion file to their state agency. The exclusion file documented the entity's intent to classify drug purchases as either 340B or Medicaid, but not both, thus providing the documentation necessary to prevent duplicate discounts. With the passage of the Affordable Care Act, Medicaid rebate administration became much more complicated. The ACA extended federal Medicaid rebates to include both fee-for-service and managed care organizations. This increased the number of prescription claims by a factor of 3. The surge in volume and complexity of the expanded Medicaid rebate process simply overwhelmed many MCOs' administration systems. Adding to the confusion is the fact that neither 340B legislation nor the ACA identified a responsible party or standard approach to protecting manufacturers from duplicate discount risks. To address this oversight, Centers for Medicare and Medicaid Services recently recommended that MCOs have sole responsibility for duplicate discount prevention. Unfortunately, CMS provided no direction about implementation, leaving the process up to each individual plan. When fully implemented, the CMS recommendation will shift responsibility for duplicate discount control from a single data source, the fee-for-service Medicaid exclusion file, to more than 270 unique MCO plans nationwide. To date, there is still no accepted standard for preventing duplicate 340B and Medicaid discounts. It is unclear whether the MCOs are up to the task. MCOs have little understanding of how 340B works. Many of their systems and processes are either error-prone or incapable of reconciling 340B purchases and Medicaid rebate requests altogether. Predictably, the system is rife with duplicate discounts. Let's review the implications. The overall risk for manufacturers is substantial. For many, duplicate discounts represent a bigger financial exposure than 340B diversion. Despite having the responsibility for preventing duplicate discounts, managed Medicaid plans are unprepared to do so. Manufacturers cannot rely on government agencies, covered entities, or any other external program controls to identify and prevent this exposure. They must develop their own plans for mitigation. That's where CiiTA can help. As the recognized leader in 340B advisory services and market intelligence for pharmaceutical manufacturers, CiiTA believes our clients need 3 things to successfully navigate the 340B program: knowledge, action, and support. Our products help manufacturers comply with 340B program requirements and mitigate its financial impact. CiiTA services include internal training for contract and compliance personnel, compliance assessment of selected covered entities, compliance dispute resolution including 340B audits, as well as ADAP formulary tracking and state-by-state Medicaid 340B requirements. If this information has been useful, please let us know. We would love to hear from you. Contact us at www.ciitallc.com, or you can email CiiTA's managing partner directly at jhardaway@ciitallc.com. Thank you for listening.